This is Community Issues, a local public affairs program focusing on the problems, needs, and interests of our community. And now your host for Community Issues, Carol Winkler.
On today's program, I'm happy to welcome back Darci Trill. She is a mobile hygienist and also the owner of Golden Scalers. And Darci, welcome to the program.
Nice to be here again, Carol.
Well, it is a pleasure. Last time we talked, we really learned a lot about mobile hygienists. And so today, I understand that you've recently gotten a master's in gerontology. So I'm wondering, what made you decide to broaden your education away from being a mobile hygienist to study gerontology?
Well, thank you for asking me, and thanks for having me here again. I still have my mobile hygiene business, and most of my patients are elderly, and so I've been dealing with this population for over 12 years. And I feel very passionate that what happens in the mouth is kind of a window to what happens to the rest of the body. And that's why I go amongst 2 counties and try to take care of people's mobile hygiene needs, because I see the correlation. But I'm just dealing with one aspect of their needs. And so a few years ago, there was a issue with the Medi-Cal benefits, that they might be taking away some of the benefits from my patients, which was about 75% of my business. So at that point, when I realized that I might not be able to bill Medi-Cal for my patients anymore, I decided to go back and broaden my horizons and get a master's in gerontology so that I could learn more about the needs of our aging population, such as the baby boomers, and expand what I can do to help this population.
Well, you know, when you made that decision to study gerontology, you put a lot of time into that. 2-3 years, I guess,
Yeah.
You know.
As I was working my business, I was doing it part-time, but part-time could sometimes mean 50 hours a week, and I was taking several classes at a time, and it took me just a little bit under 2.5 years to complete the master's degree. Yes.
Well, talk about the master's degree, gerontology, in a whole scope. What is gerontology? How does it apply to the people you've worked with in the past?
So I went and researched where I could get this master's degree, and I decided to do it virtual, so it was online, through UMass Boston, which was a very respected school, and it was one of the first ones that had a master's degree in gerontology. And basically what that means is it's the study of aging services. So successful aging now is multidimensional, and it's not just encompassing the avoidance of disease and disability, or it's not just the maintenance of physical and cognitive function, but it's also about sustaining and engaging social and productive activities. And with the baby boomers aging in such vast numbers, there's more of a need to learn more about how we can help all these people.
Do we have any statistics, any numbers on how many baby boomers are aging out every year?
I don't have that with me here. I have it at home, so I wasn't prepared for that question. But not only are people doing it in vast numbers aging quickly now because of the baby boomers, but that's also affecting the whole economy, because so many people are retiring. But now as people are aging, they're not necessarily just wanting to retire. A lot of the baby boomers are wanting to still stay in business of some sort part-time. So that's affecting the whole economy again.
So when we're talking about the lifespan, our lifespan, generally it used to be 60, 65, and you were old or elderly. And now that's just not the case. I mean, I have an 85-year-old sister who walks to the gym every day and walks home, and while she's there, she does the treadmill and does machines. Very healthy, very fit. I'm looking for 95 to 100 out of her. She's not allowed to die.
There's a lot of people that are aging longer now. So somebody who's 65 years old doesn't have the same needs as somebody 85 or 90. And there's a lot of people, as you mentioned your sister, who's in her 80s, who still is active in mind and body. But then there's another group of people, there's about a third of people once they hit 85 years old that get that disease, dementia. And so who's going to be taking care of all of these people? And are we equipped, and do we have the knowledge base that we need to take care of all these people? The collaboration amongst different healthcare professionals, it's a greater importance now than ever before with this aging population.
When my mother was still alive and we would go to the doctor, her doctor was a gerontologist doctor. So she worked in geriatrics, which is the medical side of the gerontology issue. Is that right?
Exactly. But now, with so many people aging, there needs to be more people than just the primary physician taking care of this population. Although the primary physician can still be the gatekeeper, social service workers and nurses and physical therapists, occupational therapists, and even the dental professional, we must all learn about geriatric care.
Before we started the interview, you and I were talking about one of the things that needed to be addressed, and that's environmental gerontologists. Explain to our listeners what that means.
Well, more people are wanting to age in place, and that's a good thing because it's more cost effective. The baby boomers are more demonstrative in their thinking, and they have ideas about how they want to age. And so no longer is somebody 65, 70 years old willing or wanting to go to an assisted living or a skilled nursing facility. So they're wanting to age in place, but how do they age in place safely? We were talking earlier, cupboards above the refrigerator. Is it safe for somebody 80 years old to be going on a stepladder to get their Tupperware? So we've started thinking about this in the last 20 years about possibly lower countertops for wheelchair-bound people or handrails in the shower. But there's so much more involved in making a house safe for somebody who's aging. And it's not just about somebody being in a wheelchair.
We had talked about that, and I kept thinking, I get up on a stepladder all the time to get up into the high cupboards. And I thought, if I had a pantry, I wouldn't have to do that. That would be one thing that would make a difference in my life.
There are so many simple things that can happen to making a house more age-friendly, such as if there are stairs, possibly providing a lift, getting a telephone with bigger numbers on it. I mean, there's just a lot of small little details, lighting, proper lighting, perhaps under the countertop so that they can see easier. There's so many little details, and an environmental gerontologist should be able to help somebody with some of these design issues.
Now, for anyone that's just joining us, today we're talking with Darci Trill. She is a mobile hygienist and owner of Golden Scalers with a master's in gerontology. And Darci, before we continue, would you give us your website where they can reach you and also a phone number?
Sure. So the website with my mobile hygiene business is Golden Scalers, and you can just Google that and it'll pop up. And then my phone number is 510-886-4199. And one of the things I'm doing with this new knowledge of gerontology is I want to inform and educate people about what exactly it means to be aging in place. And so although I've done some speaking engagements regarding oral care, I want to now broaden that and talk more about just aging in general on a national level.
Darci, let's talk now, if you would, about not only dementia, but that really word that we're all afraid of, which is Alzheimer's disease. How many people or how many seniors get Alzheimer's, and what can we do to prevent it? Is there anything to slow it down?
Sure. So dementia is the large term, and it's to describe various symptoms of cognitive decline. And Alzheimer's disease is just one type of dementia, although it's the one that's the most talked about and it's the most common. And it's basically just a disorder of mental processes caused by a brain disease or an injury, and it's marked by memory disorders, personality changes, impaired reasoning, loss of control, and then finally death. And it is really something that needs to be discussed and also studied more because about 1/3 of all people over 85 years old have Alzheimer's disease. So here's a couple of facts about it. There's a new case diagnosed every 4 seconds. It does affect mostly older people. And there's about an estimated 47.5 million dementia sufferers worldwide. But it is not a normal part of aging. And there are some things that everyone can do to help prevent this from happening, such as limit smoking and alcohol use. If you have arterial sclerosis, unfortunately, you're more prone to getting Alzheimer's. And that bad cholesterol that your physician talks about, that low-density lipoprotein, again, if you have that, you're more prone to this disease, and also people who suffer from diabetes. So I guess the takeaway is to try to live a healthier lifestyle, not just physically with exercise, but also mentally, whether it be crossword puzzles or just some types of brain engagement activities.
Exactly. That's one of the things I've always heard, that not only physically, but to challenge your brain, whether it's playing bridge maybe or crossword puzzles, as you mentioned. There are a lot of ways to do it, just to keep active.
Absolutely. And so when I was dealing with my patients, who many of them have Alzheimer's disease. I work in memory care units. The other problem is with so many people aging right now, and then this percentage of a third of people over 85 getting Alzheimer's disease, the next thing that pops into your head is who's going to be taking care of all these people? There's just not enough people that are trained to take care of this influx, this epidemic of people. And that's another reason I wanted to get this degree in gerontology so that I could be more informed on how to deal with this. For instance, now with this master's degree, I can run a skilled nursing facility. I can run a memory care unit. My focus is going to be more on informing and educating the public, though, nationwide. And not just the public, but also the collaboration of professionals, of how we can all come together and ride this wave out more smoothly. That's another thing is we put everybody into a box of an older category, but now we have 65 to 75-year-olds and 75-year-old to 85 and 85-year-old to 95. And I still have patients that I'm taking care of their mouth and they have all their teeth and they're 98, 101 years old. So I think we need to start thinking of different words to put these people category in, because just as you don't treat a 5-year-old the same as a 15-year-old, the person who's 65-year-old has different needs than someone who's 85 years old. One thing that I wanted to mention, too, and I've also read an article about this as well, is that baby boomers now don't automatically just want to, at age 65, stop working. And also, no one can afford to do that anymore because the life expectancy is so much longer. But the choice now is working part-time. And I'm a 55-year-old woman, and I don't see myself retiring anytime sooner than 75 or 80 years old. So now we have all these people aging that are going to be doing part-time work, which again affects the economy. And retailers need to start thinking about these consumers. They're still buying things. They're still voting. These are people that are still active, and we need to start shifting our thoughts on how to take care of them and include them into society.
I hear from older women that I don't want to look like a little girl, but I don't want to dress like my grandmother. I want something that's age appropriate, that I feel fashionable in, but conservative.
I think that there is a shift towards this. I just don't think it's happening quick enough because there's so many people now that are in this aging process, these baby boomers. They're retiring, so there's a problem with the economy as far as a lot of people leaving, and we don't have their education to fall back on anymore. It's great to have new ideas, but you still need some of the old ideas to be, intertwined with it. And now we have so many people aging, and who's going to be taking care of them? So there's all kinds of new problems that are happening at kind of the speed of lightning that we need to think about.
Darci, we're almost out of time. Any statistics you can share?
Sure. The 65 and older population is expected to reach 21% of the total United States population by the year 2040. This is a big deal.
Why?
Because never before have we had this many people aging and expected to live into their 90s and 100s.
Darci, unfortunately, we're just about out of time. So before we close, one last time, if you would give your website and then the phone number again.
My website is Golden Scalers, and my phone number is 510-886-4199. And if anybody knows of any organizations that would be interested in learning more about gerontology or these specific areas of concern with people aging, especially aging in place, please reach out to me.
Darci, once again, it was a pleasure having you.
Thank you so much, Carol.
Well, thank you. And again, we've been talking with Darci Trill. She is a mobile hygienist, owner of Golden Scalers, and also holds a master's in gerontology. And this is Carol Winkler for Community Issues.
The opinions and views expressed on Community Issues are not necessarily those of this station or management. This program is presented as a public service.
If you're aware of a need, interest, or concern in your listening area, or have any questions about the local programming you just heard, please email information@familyradio.org. To learn more about Family Radio, a beacon of truth and hope to the people of the world, or about our wonderful resources, go to familyradio.org or call toll-free 1-800 888-543-1495. And be sure to mention the program you've just heard on KEAR AM San Francisco.